Could you give up exercise to avoid surgery? I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist. I provide education, insight, and commentary on all sorts of sports and exercise injuries, injury treatments, and injury prevention for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. I've said a couple times on these videos that I love to lift weights. I've done it since my senior year of high school. I love the exercise benefits, the stress relief component. I love, obviously, the muscle size and strength. For a lot of reasons, I love lifting weights. One of the things that I've been dealing with, and I haven't really talked about it in these videos, is I've been dealing with a shoulder injury now for several months, 3-4 months, and it's just been one of those things. Certain exercises absolutely kill my shoulder, and it started to bother me in daily life. One of the things that I could consider would be giving up lifting weights to avoid having these shoulder problems. And that's what I want to talk about in today's Ask Dr. Geier video. Could you actually give up a certain type of exercise you like or a certain type of sport that you like to avoid surgery? Okay, David L. asks, I train in powerlifting, but do walking as cardio. I realized I had this swelling on my right lower leg when I run for cardio, usually within the first 10 minutes. After coming across compartment syndrome in my athletic injuries course in college, I'm 99% sure this is what I have. I was wondering, if I do have compartment syndrome, is it necessary for me to do surgery if I train in powerlifting, squat, bench, deadlift, etc., and if I stop walking and running for cardio and instead use other forms of cardio such as battle ropes? Terrific question that David asked. Basically what I was talking about with lifting weights. Can I give up a particular type of exercise, maybe do other types of exercise to avoid surgery? Just as sort of background, chronic exertional compartment syndrome is a condition where you usually see it in runners or athletes that play some sort of running sport like soccer players. But when they start running, the muscles of their legs start to swell, and they swell enough that the leg gets really tight because the fascia, this thick connective tissue that holds the muscle in different compartments, it can only expand so much. So you have all this muscle swelling, there's only so much room that it can go, and you start to hurt. Some of the people with chronic exertional compartment syndrome talk about how it feels like their legs are like a balloon that are gonna pop, and they get numbness and tingling in their feet and in their toes, and it can be a really difficult problem. If somebody truly has that, and there's a number of ways we can figure that out as doctors and as orthopedic surgeons, but you can try non-surgical treatments. You can try physical therapy and stretching and things like that, but that doesn't typically work, quite honestly. So then the question comes, basically, can I, do I have surgery so that I can get back to running, or do I give it up and maybe try something else? Most of the time that discussion is, I don't want to give up running, or I don't want to stop playing soccer, or whatever it is. And for people that aren't getting better, yes, surgery is an option. You can do a surgery where we make incisions and basically release that fascia, open up the muscle compartments, close the skin, and for the right people that does really well, and the return to sports rates are really good. But yes, you absolutely could give up running. The trick with chronic exertional compartment syndrome, though, is a lot of people also get it when they walk really fast. So at work, if they have to walk somewhere really fast, or school, or even just in town, that can potentially be tricky. And so if it starts to trickle into your activities of daily living, maybe you'd have surgery. But that is a reasonable option to say, hey, you know what, I just don't want to do this anymore. It's not my preferred method of activity. I'm going to do something else. Again, most people don't choose to go that route, but it is a reasonable option. Okay, do you have some sort of ache and pain, or maybe a real injury, and you've considered giving up your sport or your exercise? What was it, and what did you decide to do? Leave your comments below. I really would love to hear what you have to say, and I'm sure readers all over the world would love to hear it too. If you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention, subscribe to my YouTube channel. Click the button in the upper right corner of this page. You'll get videos. I record a couple of these every single week, and I'll deliver those directly to you. Thank you so much for watching. I hope this was helpful. If you're dealing with an injury and are thinking about giving up sports or exercise, I'd love to hear from you, and I look forward to seeing you right here next time.